Greetings. I'm Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, and I'd like to share with you an overview of an editorial that I've written for the January 2016 issue of the journal entitled Celebrating Mayo Clinic Proceedings 90th Anniversary, A Story of Longevity and Progression of Mission. This editorial describes how, on April 21, 1926, the first issue of the predecessor of the Proceedings was published. It was entitled Bulletin of the Mayo Clinic and the Mayo Foundation. This publication had 3 name changes in its first 9 months, settling on the title Proceedings of the Staff Meetings of the Mayo Clinic. This title lasted from January 1927 through December 1963, at which time the title was shortened to Mayo Clinic Proceedings. Coincident with this shortening of the title, the journal was put under the leadership for the first time of an editor-in-chief and editorial board. It had had a long association with the Mayo Clinic section of publications, later named the Mayo Clinic section of scientific publications. This relationship was in large measure due to the influence of Maud Mellish Wilson, who had been hired by the Mayo brothers in the early 1900s to oversee the libraries and help the Mayo Clinic physicians write their scientific reports. Mayo Clinic physicians were invited to attend weekly staff meetings in which members of the staff would report on interesting cases, or they would talk about information they had gained not only through attending meetings but through their readings and other methods. Ms. Wilson was asked to collate these materials and include these in a report that would document the presentations at the weekly staff meetings. It is noteworthy that by 1926 there were 100 members of the Mayo Clinic physician staff. This also was a time in which St. Mary's Hospital had expanded to 650 beds and now was treating almost 9,000 patients per year, the overwhelming fraction of whom had come to Rochester for surgical treatment, such that by 1926, St. Mary's Hospital was performing more surgeries than any other hospital in North America. On the downtown campus, the plans were being made to open the new Plummer building, which would house the integrated group practice of Mayo Clinic. For a brief period after its opening, the Plummer building was the tallest building in the state of Minnesota. Throughout this period and beyond, Mayo Clinic Proceedings documented many of the innovations and growth at Mayo Clinic proper. The journal started on a small scale, simply to provide a service to the 100 staff members, such that in the early days there were only 260 copies included in the print run of the journal. This has expanded to more than 31,000 copies by 1958, and the journal has continued to grow such that today its print circulation is more than 127,000. This makes it the 3rd largest print run of any scholarly biomedical journal in the world. This is significant because when we survey our readers and ask them if they could have only one form of the journal, print only or electronic only, our readers say that by a margin of 2 to 1 they prefer print. The journal has in recent years undergone tremendous growth coincident with an initiative begun in 1999 and announced formally in 2000 known as the Evolution of Mayo Clinic Proceedings. During this period, impact factor and assessment of the quality of content of the journal has increased numerically for 14 out of the 15 consecutive years that the data have been reported, such that now the Proceedings has an impact factor of 6.262, making it the 11th highest impact factor among 154 general internal medicine journals worldwide. The journal has also done well in terms of its readership. For example, the 2013 Essential Journal Study, sponsored in part by the New England Journal of Medicine, ranked the journal as number 4 as an essential journal among internal medicine readers. When we look at some of the subspecialists who are in the internal medicine community, we see that the Proceedings ranks number 6 among cardiologists, number 7 among hospitalists, and number 10 among rheumatologists. These latter groups are important because the Proceedings is a general medical journal, and most of the readership of these subspecialties prefer subspecialty journals. and despite this, the Proceedings is a valued source of general medical information among internal medicine specialists and subspecialists. The Proceedings content is disseminated not only through the print journal, but also through the publisher's institutional platforms, as well as the journal's website, social media, and reports in the lay media. In aggregate, this allows us to reach more than 1 billion people per year with information about the scientific research, review articles, and other information in Mayo Clinic Proceedings. The editorial board and I envision that from this point forward, growth at the journal will be more of the type seen with evolution as opposed to revolution. For example, during 2016, the journal will start publishing multiple symposia collections simultaneously. During the early parts of the year, we will continue publishing the Symposium on Pain, and we will continue to publish the Symposium on Neoplastic Hematology and Medical Oncology. Midway through 2016, we also will begin a briefer symposium collection, the Symposium on Precision Medicine. The journal will continue to publish articles from which physicians can gain continuing medical education credit. This would include the symposia articles as well as a concise review for clinicians articles. There are other educational elements of the journal that will not have continuing medical education credit available. These will include residence clinics and the newly introduced Path to Patients image quiz. In this latter category, images from the pathology laboratory, x-rays, and other sources are provided to readers, and a quiz is provided to test their knowledge about disease processes. At this 90th anniversary of Mayo Clinic Proceedings, the journal has greatly grown from its humble origins. It began as a provincial in-house newsletter type publication, and now is one of the world's foremost medical journals. We thank you for your ongoing support and loyalty to the journal. The leadership of the journal will do its best to ensure that the Proceedings will continue to serve as an elite medical journal sponsored by Mayo Clinic and authored by physicians and others worldwide. Thank you. We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.